This is Aqib Hussain from the Department of MLT. Today the topic of my presentation is mycobacterium tuberculosis. My registration number is MLT 2021-2065. The outline of my presentation is epidemiology, generation of droplet nuclei, risk factors, route of transmission, classification of tuberculosis, pathophysiology of tuberculosis. Now we discuss about epidemiology. Let's start with the epidemiology, the branch of medicine which deals with the incidence, distributions, and possible control of disease and other factor relating by health. Now, generation of droplet nuclei. One cough produces 500 droplets. The average TB patient generates 75,000 droplets per day. Before therapy, at least 104 bacilli are required for an effective transmission. This falls to 25 infectious droplets per day within 2 weeks or effective therapy. Now, risk factors: close contact with infected person, immunocompromised, HIV post transplantation, renal failure, diabetes, smoking, drug abuse users, malnutrition, overcrowding in poorly ventilated rooms, healthcare workers. Now, route of transmissions. Here is the 3 route of transmissions: droplet infection, ingestion of milk, contamination of abrasion. First, we discuss about droplet infection, person to person by inhalation of aerosols, mycobacterium tuberculosis, pulmonary tuberculosis. Ingestion of milk, this is second one. Infected cattle, mycobacterium bovis, intestinal tuberculosis. Now, the third one is contamination of abrasion, laboratory workers, and skin infections. Classification of tuberculosis. Pulmonary, there are 2 types of classification: pulmonary tuberculosis and extrapulmonary tuberculosis. 80% of total cases of pulmonary tuberculosis. In pulmonary tuberculosis, mycobacterium infect lungs. In extrapulmonary tuberculosis, bacteria is the circulation leads to bacteremia. Bacteremia is the combination of 2 words: bacteremia. Mia means blood, so it indicates the bacteria in the blood. Pulmonary tuberculosis, infected lungs, distributed within macrophages, facultative intracellular pathogen, inhibit phagosome, lysosome fusion, resist lysosomal enzymes, bacilli multiply in alveolar macrophages, and early tuberculosis granuloma is formed. Extrapulmonary tuberculosis, 15 to 20% total cases. Bacteria on circulation leads to bacteremia, leads to the involvement of GUT, genitourinary system, meningitis, gastrointestinal system, skin, lymph nodes, bone marrow, spinal infection, arthritis. Now, here is some pics of skin infections, chest infection. Now, pathophysiology of tuberculosis. Patho means, first of all, we know about pathophysiology. First, pathophysiology means the study of abnormal changes in body functions intracellular. It's inhaled in droplets, coughed out by patients with active TB. Intracellular pathogens, microorganisms that live inside the cell. Help spread with the body in immune invasion, allow long-term persistence, latent disease, stimulates the formation of granulomes, lifelong survival inside macrophage. Latent disease means that remain inactive in the body, typically causes no symptoms and early stage. Become active disease in immunocompromised person, mainly affect lungs, pulmonary TB, but can spread to affect almost anywhere extrapulmonary. This diagram shows the route transmission of pathogens. Now, first, the pathogens enter by aerosol droplet. It's uninfected, then it goes to the primary infection, ingestion of infected milk or sputum, then latent infection, primary disease, lymphatic dissemination, lymph node, then from lymph node this goes to homogeneous dissemination, heterogeneous dissemination, passive process in which cells are sloughed off from tumor into the lumen of a vessel. Now it goes to the extrapulmonary involvement. Now I ending my topic at that point. Thank you for listening.